Welcome to Chapter 5 of our course. This chapter is entitled Measurement of Implementation Research Outcomes. By the end of this session, you will understand what implementation research outcomes are. Recognize the factors that define the context of implementation research. Explain how to measure implementation research outcomes. Let's start by defining implementation research outcomes. People sometimes mix up implementation effectiveness with treatment effectiveness. The difference between the two is that implementation effectiveness goes beyond just measuring fidelity or checking if something is done according to plan. It also looks at how well the model is adopted and used, and what helps or hinders its adoption. Treatment effectiveness is about how likely a treatment method will benefit patients in a specific clinical population when administered in clinical practice. This confusion also affects how we grasp the difference between implementation outcomes and outcomes related to service systems and clinical treatments. For this reason, it's crucial to define implementation outcomes clearly. This helps us understand how implementation processes work, makes implementation research more effective, and allows us to compare different implementation strategies. To start, we need to understand what implementation variables are. Generally, these are factors like acceptability, appropriateness, and feasibility, which help us gauge how well an implementation process is functioning. Let's take a moment to define these outcomes properly. Acceptability is the perception among implementation stakeholders that a given treatment, service, practice, or innovation is agreeable, palatable, or satisfactory. Adoption is the intention, initial decision, or action to try or employ an innovation or evidence-based practice. Appropriateness is the perceived fit, relevance, or compatibility of the innovation or evidence-based practice for a given practice setting, provider, or consumer, and/or the perceived fit of the innovation to address a particular issue or problem. Cost refers to the cost impact of an implementation effort. Fidelity is the extent to which a new treatment or innovation can be successfully used or carried out within a given agency or setting. Penetration refers to the integration of a practice within a service setting and its subsystems. Sustainability speaks of the extent to which a newly implemented treatment is maintained or institutionalized within a service setting's ongoing, stable operation. For any treatment or intervention to work, it needs to be put into action properly. Implementation research outcomes are essential for achieving the desired changes in clinical or service outcomes later on. For example, in order to appropriately interpret outcomes, the Maternity Homes Access in Zambia project, MAMAS, evaluated the impact of a maternity waiting home model on women's access to safe delivery in rural Zambia. This helped them to understand not only the effectiveness of the intervention but also the effectiveness of their implementation. In a study by Henry, Ngoma, Kaiser et al., they looked at how well MAMAS was put into practice. They didn't just check if it was done correctly, they also found out what factors influenced its success and its ability to keep going in the long term. Proctor et al. Has developed a useful framework to help explain implementation outcomes. The framework distinguishes between three distinct but interrelated types of outcomes: implementation, service, and client outcomes. We've already gone through implementation outcomes. Let's look at service and client outcomes. Service outcomes include efficiency, safety, effectiveness, equity, patient-centeredness, and timeliness. Client outcomes include satisfaction, function, and symptomatology. It's important to highlight that implementation research outcomes are different from service and clinical effectiveness outcomes. Implementation outcomes come before both service and client outcomes, and the results of implementation efforts affect these later outcomes. Let's look at the variables that describe the context that implementation research takes place in. The term context is derived from the Latin phrase to weave. Understanding what happens when an evidence-based intervention, program, method, or service is woven together with a team is important to better address implementation challenges in healthcare and other settings. The influence of context explains how or why certain implementation outcomes are reached and others are not. Context is considered responsible for study-to-study variations in outcomes and could be looked at from inner and outer contexts. Damschroeder et al., in their Consolidated Framework for Implementation Research, CFIR, define the outer setting as the economic, political, and social context within which an organization resides, and the inner setting as the structural, political, and cultural contexts through which the implementation process will proceed. The line between the two is not always clear, and the interface is dynamic and sometimes precarious. There are several factors to consider when choosing implementation outcomes. The choice of an outcome may be influenced by the specific barriers to implementation you have observed, the novelty of the evidence-based practice you are trying to implement, the setting in which implementation is taking place, the resources for and quality of usual training for implementation. Proctor et al. Suggest that the stage of implementation and the unit of analysis can help decide which implementation outcomes to focus on. For instance, it might be better to study acceptability in the early stages of implementation, while sustainability could be measured later on. Here are the 8 implementation outcomes, with their corresponding terminologies, and examples of articles with measures. Note that there may also be other implementation research outcomes depending on context and type of intervention. Let's summarize what we have learnt in this chapter. Implementation research outcomes are intentional actions which are undertaken so an intervention can be delivered. The choice of outcomes depends on the intervention implementation stage or phase. Commonly used implementation research outcomes are acceptability, adoption, appropriateness, cost, feasibility, fidelity, penetration, and sustainability. That's it for Chapter 5, but before you go, take a moment to consolidate what you have learnt by putting it into practice. Download this chapter's supporting resource material and complete the activity there. Once you have completed the activity, please join us for Chapter 6, where we will learn about internal validity in implementation research.